Welcome back, everyone. Have you noticed a loss of concentration or libido in your man? Well, he could have low testosterone, which can lead to other troubling medical issues. Joining us now to explain how Low T Nation can help is CEO Brandon Addison. Brandon, thank you for being here.
Thank you. Appreciate it.
Of course. So what exactly is low testosterone?
Low T is, in general, it's just a lower than optimal or a lower than necessary level of testosterone in a man's body for his own individual physiology.
And how would a man know if he has low testosterone or not?
There's a couple of different ways. Primarily, we have to run a blood test and see where the guy's at. But there's a little bit of ambiguity involved in the blood work, where some guys walk around at a total testosterone level of about 1,000. Other guys walk around at 500. So if a guy comes back and he's at, say, 450, well, it's low if the guy was at 1,000, but it's not necessarily low if that guy was at 500. So we have to couple the blood work with some symptomatic qualifiers like loss of focus and concentration, loss of libido, irritability, frustration, anxiety, and also loss of muscle and gaining that stubborn belly fat that some guys can't get rid of as well.
Exactly. So basically, it's an individual basis. There isn't just like a specific number that all the men in the world should be
Absolutely not. It's very individualized to the patient. We carry some patients at an optimal level of over 2 times what we carry other patients at, just based on their own individual needs.
Sure. And talk about risks. Any risks at all for anybody with taking testosterone treatments?
Well, it is a medical procedure, so it's not responsible to say there's no risks involved, but all we're doing is putting bioidentical hormones back into the body where they belong at the levels they belong at. That's what makes it safe. The real risk, honestly, is low testosterone.
Right.
Low T has been proven causative for heart disease, cancer, diabetes, osteoporosis, metabolic syndrome. And those are the big killers, that are killing most men. In fact, studies are showing that men with low testosterone die significantly faster than men with healthy levels of testosterone.
And talk to me also about women are such open books. Why is this an issue that men are not talking about? Just typical way that men approach, I feel like, healthcare or treatment, just don't want to really explore that?
There's an education issue. A lot of men don't know how dangerous low T really is. That's one thing. As that education kind of proliferates, it will be talked about more. But yeah, at the end of the day, we're just men. We don't go to our physicals the way we should. We don't go to see our doctors the way we should. We just assume things are going to get better. And with low T, they don't. They actually get worse, and it becomes a very dangerous chronic problem.
Absolutely. And when I know we were talking before you came on the show, and I was saying we don't really have doctors that specifically approach this. And we have men that watch our show. We have lots of women who might be listening for the man in their life. And what would you say really makes your clinic somewhere that people need to go to find these kinds of solutions?
Unfortunately, most doctors don't get specific training on this. They don't teach doctors how to do hormone replacement in med school.
Right.
So your family practitioner or just a general practitioner is not going to have the training necessary to do this. All of our doctors have gone to this group called the A4M. They're the absolute tip of the spear in thought leadership, and they developed that gold standard of patient care for hormone replacement. All of our curriculum that we train other doctors with is also built on those guidelines, so we know how to take care of patients because we just learn from the best of the best in the business.
And what are you seeing age-wise has been affected by this? Is it getting younger? Is it still skewing older?
It's actually getting younger. The average 30-year-old's testosterone level just declined every single year.
Wow, as young as 30.
Right. We have, obviously, our sweet spot is from 40 to 65, something like that, but we have a boatload of guys in their 30s that medically qualify, that truly medically qualify for low T treatment.
I like that we're talking about this, not just in a sexual aspect, but also who knew, as we showed you the graphic earlier in the segment, all the different things that it could be, that irritability, the fatigue. So if your husband or man in your life is experiencing that, it could be, this could be the reason.
Absolutely.
Not just the daily stressors of life, right?
Yeah, absolutely. A lot of guys kind of correlate low T with either the bedroom or the weight room, but it definitely has a huge impact in the classroom, in the conference room, in the boardroom. It really affects men in all areas of their life, and probably most importantly, the living room at night, because if you don't have the energy to get through the day, you can't spend the time with your kids you need, you can't spend the time with your wife or significant other that you need.
So true.
So it really is it's a bad thing when with testosterone levels get low.
Right. And really, what do you want our viewers to take away here today?
Primarily that low T, number one, is dangerous. It's very dangerous to have low T. And number two, you don't necessarily have to feel older as you get older. I mean, we all know those 60 and 70-year-olds that are running circles around the 30-year-olds on the couch, right?
Right.
And a lot of times that's because their hormones are in a much better place. When guys come and get on our program, they really do feel like they're better husbands, they're better dads, they're better bosses, they're better at work. It improves almost every facet of their life when they get the help they need.
Fantastic. Great information. I understand you offer free consultations, right?
Absolutely. We want to make sure that guys feel comfortable coming to us. There's nothing up front that they have to worry about. We'll tell them all about our program. We tell them all about the symptoms and risks involved. And if it's something they want to actually continue with, getting qualified for our program is almost next to nothing. So.
Fantastic. Great information, Brandon. Thank you so much. We appreciate your time.
Thank you.
If you would like to contact Low T Nation, where are you located? I forgot to ask.
We're in Atlanta at Peachtree and 17th.
Peachtree and 17th. Always important to know where that location is. Please, if you'd like to learn more, go to 866-FIX-LOW-T or go to the website at lowtnation.com. Learn more today and take advantage of that free consultation to feel better. Again, whether it's the man in your life or you're a man watching, don't wait a minute longer to feel your absolute best. And this segment was paid for by Low T Nation.